Hello, I'm Dr. Evelyn Reed, and welcome to the Florida Elder Care Training Series. When we talk about dementia, we often focus on memory loss. But memory loss alone doesn't define dementia. The most critical component in diagnosing the disease is something called functional status. Functional status is the real-world measure of how cognitive decline is impacting a person's life. This is crucial. A person can have noticeable cognitive changes, what we might call mild cognitive impairment or normal aging. But if they can still manage their daily life independently, it is not dementia. The diagnosis shifts to dementia only when those cognitive deficits interfere with their independence. Today, we will explore how we measure functional status and what this decline looks like in practice. We divide functional activities into two categories. The first is instrumental activities of daily living, or IADLs. Think of these as the skills needed to manage my life. IADLs are complex activities requiring higher-level thinking, planning, organization, and problem-solving. Because they are complex, they are usually the first abilities affected in early dementia. Let's look at some examples. Managing finances. In a healthy adult, this means paying bills on time and balancing a checkbook. Impairment looks like frequent errors, unpaid bills, confusion over banking, or sadly, falling victim to financial scams. Meal preparation. This involves planning, following recipes, and using appliances safely. Impairment might look like burnt food, using incorrect ingredients, an inability to follow simple recipes, or forgetting to turn off the stove. Medication management, taking the correct doses at the right time. Impairment includes missing doses, double dosing, or confusion about why they take certain medications. Other IADLs include transportation, getting lost while driving, or an inability to use public transport, and housekeeping, where you might see a significant decline in the cleanliness of the home. These struggles with complex tasks are often the earliest functional warning signs of dementia. The second category is basic activities of daily living, or ADLs. Think of these as the fundamental skills needed to care for myself. ADLs are essential self-care tasks. Because these tasks are simpler and often deeply ingrained habits, impairment in ADLs typically signifies that the dementia has progressed to a moderate or advanced stage. Examples include bathing and dressing. Impairment might look like neglecting personal hygiene, refusing to shower, wearing clothing inappropriate for the weather, or difficulty with buttons and zippers. Other ADLs include toileting and continence, eating, such as difficulty using utensils or forgetting to swallow, and transferring, needing assistance to move from a bed to a chair or to walk safely. When a person begins to need help with these basic self-care tasks, it indicates a significant functional decline. How do doctors determine functional status? We can't follow a patient around all day. This is where you, the caregiver, become essential. Healthcare professionals rely heavily on informant reports, the detailed observations provided by family members or caregivers. This is vital because individuals with dementia often lack insight into their own deficits. They may genuinely believe they are managing fine, even when they are not. You provide the objective reality. When reporting to a doctor, be specific. Don't just say he's having trouble with money. Say, he forgot to pay the electric bill twice, and I now have to manage all the finances. Doctors use standardized tools to quantify this information. You might hear terms like the CATS ADL index, the Lawton IADL scale, or the FAST scale. These tools help us systematically measure independence in specific areas, from handling finances to basic bathing, and track changes over time. Understanding the typical progression of functional decline can help caregivers anticipate future needs. One common tool used specifically for Alzheimer's is the Functional Assessment Staging Tool, or FAST scale. In the earliest stages, FAST 1-3, a person might complain of forgetting things or have subjective work difficulties, but they are still functionally independent. Stages 4 and 5 represent early dementia. This is where the decline in IADLs becomes evident. They have decreased ability to perform complex tasks like handling personal finances, planning a dinner party, or traveling to new locations. They might also need assistance choosing proper clothing. Stage 6 represents middle dementia. This is a significant turning point where the decline in basic ADLs begins. They may start improperly putting on clothes without assistance, be unable to bathe properly, like adjusting water temperature, or have difficulty with the mechanics of toileting. Urinary and fecal incontinence often begin in this stage. Stage 7 represents late or severe dementia. Cognitive impairment is profound, and the individual is severely functionally dependent. Speech ability becomes extremely limited. They lose the ability to walk without assistance, then the ability to sit up, and eventually, even the ability to smile or hold their head up independently. Functional status is the practical litmus test for dementia. It moves the diagnosis beyond what's happening in the brain to how is this affecting the person's ability to live their life. Recognizing the early markers, the struggles with finances, medications, and cooking, and understanding the progression toward needing help with basic self-care allows for timely diagnosis and better care planning. Your careful observation and detailed reporting of these functional changes are vital. You provide the insights that ensure your loved one receives the appropriate level of care throughout their journey.